Have you ever heard of a medical mystery where the problem just vanishes? We're not talking about a simple headache. We're talking about a piece of your actual spine that slips out of place, causes some pretty serious pain, and then, believe it or not, sometimes heals all on its own. So let's dive into the incredible case of the vanishing spinal disc.
This is the big question, isn't it? For anyone who's dealt with bad back pain, the idea that a herniated disc could just fix itself seems almost too good to be true. So can it? Let's find out.
And here we go. This is our smoking gun. What you're looking at is a series of MRI scans taken over a single year. In that first image, A, you can see that big blob? That's a large herniated disc. But just watch what happens over the next 12 months. It gets smaller and smaller until it's almost completely gone. No surgery, it just vanished. And get this isn't some 1 in a million medical fluke. Not at all. Some sources suggest that up to 70% of herniated discs can heal just like this, all by themselves. It's actually a pretty common phenomenon, but most people have no idea. So how on earth is this possible? Okay, to solve this mystery, we've got to understand the scene of the crime. So what exactly is a herniated disc? Let's break it down. Think of your spinal discs as little jelly donuts sitting between your vertebrae. A herniation is what happens when some of that jelly, on the inside, it's called the nucleus pulposus, squeezes its way out. Now there are a few different types. A protrusion is just a simple bulge. An extrusion is when that jelly actually breaks through the outer wall. And then there's sequestration. This is the most dramatic one, where a piece breaks off completely and it's just floating around. Now you're going to want to remember that last one. It is a critical clue. All right, get ready for a major plot twist. You would think the most severe-looking herniation would have the worst chance of healing, right? Wrong. The data shows the exact opposite. Sequestration, that free-floating piece we were just talking about, has a staggering 96% chance of spontaneously disappearing. Meanwhile, the mildest kind, the simple bulge, it has the lowest chance. How can that possibly be? Well, the answer lies with the unsung hero of this story, your body's own internal cleanup crew. Yep, we're talking about the immune system. Let's see how it pulls off this incredible disappearing act. Here's the absolute key to this whole thing. The soft, jelly-like stuff in the center of your disc is normally completely hidden from your immune system. It's what's called immune privileged. So when a piece breaks off and is suddenly exposed, your body has no idea what it is. It sees a piece of your own spine as a foreign invader and immediately mounts an attack. And who leads this attack? Meet the macrophages. You can think of these guys as the Pac-Man cells of your immune system. They are the cleanup crew, and their entire job is to find anything that shouldn't be there, surround it, and just digest it. So when they find that foreign disc fragment, they get right to work. You know, the process is surprisingly simple. First, the herniation happens, exposing all that jelly-like material. Second, the immune system sounds the alarm, flagging it as an intruder. Third, it sends in the special forces, the macrophages. And fourth, those macrophages literally eat away at the fragment until it is gone. And that explains why the most severe type, sequestration, heals the best. Because it's the most exposed, it triggers the biggest, most aggressive cleanup response from the immune system. Okay, so now we know how it happens. But can we look for clues that predict when it's most likely to happen? What are the signs that this amazing healing process is underway? It turns out doctors can look for several key signs. We already know the type of herniation is number one. Sequestration is the most likely to go away. But get this, size also matters. Larger fragments actually present a bigger, juicier target for the immune system. A tear in a key ligament nearby also helps because it basically opens the floodgates for that cleanup crew. And what's really cool is that doctors can actually see this cleanup process happening on an MRI. And here's one of the coolest signs of all. It's literally called the bullseye sign. That bright ring you can see on the MRI, that's a direct visual of the immune response in action. It's showing inflammation and the growth of new blood vessels, all of which are bringing in even more of those macrophage cleanup cells. It's a literal bullseye, marking the exact spot where healing is taking place. So, we've seen how the immune system's inflammatory response is the absolute key to healing. But this all leads to a final, really surprising twist that might just change how we think about treating back pain altogether. So if inflammation is actually the solution, what happens when our very first instinct is to try and stop it? Could the common painkillers we take to feel better actually be getting in the way of our body's own healing plan? And this right here is the paradox. The body's natural healing process is driven by inflammation. But what's our go-to first-line treatment for the pain? Anti-inflammatory drugs like ibuprofen. So we are actively trying to shut down the very process that might be trying to heal us. And this isn't just a wild theory. This quote from one of our main sources, a 2023 review in the Journal of Bone and Joint Surgery, explicitly questions the whole role of these common medications right after herniation. It highlights this major conflict between our treatment goals and our body's natural strategy.
So what's the big takeaway from all this? Well, it seems the story of a herniated disc is far more complex and, frankly, more incredible than we thought. The body has a remarkable, if sometimes painful, ability to heal itself. And this leaves us with a provocative final question. If the path to healing is literally through the fire of inflammation, do we need to completely rethink our entire approach to managing acute back pain? It's a crucial conversation to start having.